Hello, I'm Dr. Barbara Oswald, and this is our Module 6 overview for our PSS 312 Drugs and Behavior class. Module 6 covers prevention and treatment of substance abuse and addiction. Notice in this module, we're actually going to go a little bit out of order of the chapters and talk about prevention first and then treatment, because the best treatment for substance abuse is prevention. So, by the end of this module, students should be able to at least distinguish between primary, secondary, and tertiary prevention and describe the target population and goals for each type of prevention. We'll talk about this in discussion option 1 and homework question 1, along with the Module 6 exam. Next, students will be able to compare and contrast several models of prevention. We'll talk about these in discussion option 2, 3, homework question 2, and the Module 6 exam. Next, we will critically evaluate NIDA, that's the National Institute on Drug Abuse, NIDA's 16 Principles of Drug Abuse Prevention Programs developed in 2003. We'll talk about these in discussion option 2, homework question 3, and the Module 6 exam. Next, we'll compare and contrast several prevention programs, including the program requirements and their efficacy or effectiveness. This will be covered in discussions options 1 through 4, homework question 4, and the Module 6 exam. Next, we'll define and apply the biopsychosocial model of drug abuse treatment, and you'll demonstrate your knowledge of that in homework question 5. Next, we'll compare and contrast treatments for alcohol use disorder specifically, identifying those with the greatest efficacy or effectiveness. We'll talk about this in discussion option 5, and you'll be assessed on your knowledge in homework question 6. And then finally, we'll finish this module by comparing and contrasting treatments for drug disorders, drug abuse disorders that don't include alcohol use disorder, and we'll identify those with the greatest efficacy. And that'll be addressed in homework question 7. So what exactly do you have to do for Module 6? Well, like in past modules, you're going to read chapters 16 first on prevention and then chapter 15 on treatments in our textbook. You'll read the Module 6 research article provided on Canvas. It's actually a really interesting article because it's assessing a prevention program that was actually utilized here in Cincinnati. So it's got these local connections. So hopefully you'll find that to be a pretty interesting article. As with previous modules, you have the opportunity to take some practice quizzes to test your knowledge over the chapter readings. You'll participate in the Module 6 discussion, you'll complete the Module 6 homework questions, and you'll take the Module 6 exam. So, why, again, are we talking about prevention first? And as I mentioned earlier, that's because the best treatment for addiction is prevention. So what are we going to talk about when we talk about prevention? Well, in chapter 16, we'll define what they mean by prevention. We'll talk about the various modules of prevention, the principles of prevention, and then we'll address the different types of prevention programs, of course, assessing the efficacy of each one. Obviously, preventing substance use is extremely challenging and difficult. For any of you who've gone through DARE, or remember the This Is Your Brain on Drugs campaigns, those kinds of things, we know that preventing substance use is extremely difficult. So that will be our challenge in this module, is to try to understand why it's so hard and think of ways that we can do this better moving forward. Finally, we'll finish the module by talking about existing treatment programs. So we'll first talk about motivation to change as the main factor in treating substance use disorders. So we know that people who become addicted to substances are oftentimes in denial about their addiction, or they acknowledge their addiction but they don't want to change. If they don't want to change, we cannot make them change. So we'll try to address that and how we can encourage people to become more motivated to change. Then we'll talk about the efficacy of various types of treatments. We'll talk about the self-help groups. These are primarily centered on the 12-step programs, Alcoholics Anonymous, Narcotics Anonymous, and other 12-step programs that both help addicts and their families. We'll look at how effective those are. I'll mention here they tend to actually be very effective because people who join those groups tend to be very motivated to change. So they do have quite a bit of efficacy, especially when compared to some of the other programs out there. Then we want to talk about the different models of substance abuse disorders or substance use disorders, SUDs, because different substances have different treatment potential outcomes. For example, methadone maintenance therapy or buprenorphine treatment are extraordinarily effective in combating heroin addiction. Yet they're really controversial because people realize that it's substituting one addiction for another. And so we'll kind of look at that. We contrast that with stimulant abuse and addiction. Stimulant abuse and addiction is extraordinarily difficult to treat because we don't have any kind of medication-assisted treatment for that. So we'll start to address some of the issues surrounding these models of the various substance use disorders and how that relates to their treatment. We'll talk about the professional treatments. These are like inpatient hospital treatments. It could also be one-on-one counselor kind of treatments. We'll talk about the treatments specifically for alcohol use disorder, including some behavioral treatments, treatments with the drug Antabuse, which is not a replacement treatment like methadone maintenance, but it actually makes users physically ill, violently sick, if they drink while they're also taking Antabuse. And so we'll talk about some of the issues around that, the compliance issues primarily. Antabuse winds up being not very effective at all because obviously if you want to drink, you just don't take the pill. Or I've actually known people who've taken Antabuse and drink because they know as soon as they drink, they'll throw it up, and then they can continue to drink like normal. So anyway, we'll address some of the different alcohol use disorder treatments. We'll compare and contrast this with some of the different substance use disorder treatments. We'll talk about the economic factors associated with abuse and addiction and its treatment. And then finally, the book tells us about what they call the stepped care approach, which would be probably the best approach to trying to treat any type of abuse or addiction problem. As always, contact me, send me an email if you have any questions, and I look forward to learning with you in this Module 6, our final content module for our class together.